Last year, I had surgery on my nose so I could breathe again. Oh yes, my nose was broken in 2 spots. It's been broken since like high school, so I finally got it fixed. And it's been nice. Breathing? Oh man, incredible. I was like missing out on it, you know? But when I was in the hospital, the doctors gave me some really strong pain medication. You know, I had woken up and they were like, we're gonna give you some pain medication. And I was like, what is it? And the doctor told me it was fentanyl. And at first I was like, fentanyl? Doesn't that kill everyone, fentanyl? But after a few seconds, I was like, wow. This is great. It worked really well. Turns out fentanyl has been used in hospitals for a long time. It's used in epidurals, it's prescribed for cancer patients, and there was a time when doctors were even putting it in lollipops. I don't know about you, but for me, it feels like fentanyl came out over like the last few years just out of nowhere. So I was like, dude, what is up with fentanyl? And surprise, surprise, it actually has a long and crazy history. So how did America, Big Pharma, and a well-meaning scientist create the most powerful and deadly drug in history? I mean, where is this stuff even coming from? And how did the fentanyl epidemic become a problem too big to stop? Well, let's find out now. Join me for the dark history of fentanyl. Hi friends, I hope you're having a wonderful day today. My name is Bailey Sarian and I'd like to welcome you to my podcast, Dark History. Hi. Here, we believe history does not have to be boring. It might be tragic. Sometimes it's happy. A lot of times it's sad. But either way, it's our dark history. Now, before we get into it, don't forget to like and subscribe because I'm always posting new content. And let me know what you think down below in the comment section because I'd love to hear from you. Now, let's get into it. Fentanyl. I know it's kind of like a heavy topic, but look, I had a lot of questions. I don't know about you guys, but for me personally, since like 2020, I've known about 7 people who have died from fentanyl. 7. And that's just me. And it feels like everyone has been touched by it in some kind of way. And I personally just want to know, like, dude, where does this thing come from? Because it truly felt like out of nowhere. It just was like here, and a lot of people were dying, right? Or maybe not to you, but for me. And I wanted to know how, when, where, what, who, how. What is this? What is this? So, let's start from the beginning. What we do know is that fentanyl is what's known as a synthetic opioid. Now, synthetic means it is manufactured rather than like found in nature. Like think of like poppies in The Wizard of Oz. That's like found in nature, you know? So who made it and why has been my question. Now, it all started with a man from Belgium named Paul. I know, what are the odds of that, Paul, huh? I know. His name was Paul Jansen. Now, Paul was born in September of 1926 in the city of Turnhout in Belgium. Now, when Paul was a kid, his younger sister, she was like 4, she sadly died of tuberculosis. That's a hard one for me. But, you know, that was like a death sentence. And this tragedy made Paul passionate about going into medicine. Maybe he thought like with the right medication or the medicine, like he could have helped or saved his sister. Or he wanted to like make sure no other children would go through what his sister did. But despite like not having much money, Paul worked hard to start his own research lab by the time he was 27. He called it Janssen Pharmaceutica. Paul was specifically interested in pain management. Now, at this time, there were 2 main pain relief drugs being used by doctors. There was morphine and meperidine. Now, these 2 were fine. They did the job. People would have to take high doses, and eventually they would be in less pain. Like, it worked. But Paul wanted to find a stronger and quicker solution for pain. So Paul's lab made an important discovery about pain relief drugs. Not to get all chemistry on you, keep it simple, but they realized that both morphine and meperidine had a chemical structure called a piperidine ring. Just go with me. Like they had this like same thing to it. They had the same feature, okay? And like this piperidine ring, whatever it's called, was the magical ingredient that was making the pain go away. So Paul's like, okay, let's take that little magic and put it in a pill that will work faster and better. But of course, this would be easier said than done. So between 1953 and 1957, Paul's lab was getting closer and closer to a pain reliever like morphine, but in smaller and faster acting doses. Finally, Paul's lab created something called phenoparadine. This was about 50 times stronger than meperidine and 25 times stronger than morphine. So this shit was strong, okay? So Paul and his team introduced this new drug called phenoparadine to a few European markets. Now, people liked it. It was working, but Paul wasn't satisfied. He was sure that he could make a painkiller even better. And then in 1960, he finally did it. Paul Janssen's team created the strongest pain reliever that had ever existed. They called it Fentanyl.
One of my New Year's resolutions this year is to travel more. I mean, every year I say I'm going to do it, then I get overwhelmed. But I swear, okay, look, this year I'm going to do it, okay? I'm going to do it. I'm going to pick a place and then I'm going to go. Naturally, because I'm a go-getter, I want to learn the language. I know, it's ambitious, but that's me, baby. I'm all in, and this year I know I can do it with the help of Rosetta Stone. Rosetta Stone is the most trusted language learning program available on desktop or as an app, and it truly immerses you in the language that you want to learn. Plus, they've been, a trusted expert for freaking, 30 years? Yeah, 30 years. They have millions of users, and they offer 25 languages like Spanish, Korean, Arabic, Polish. It's on there, baby. Rosetta Stone offers something called the True Accent feature, which gives you feedback on your pronunciation so you can feel confident in whatever you're saying. It's funny because I need that in English. Okay. You can choose to practice on your desktop, or you can take Rosetta Stone to go with the mobile app, so you can learn language anywhere. Listen, right now, Rosetta Stone is offering a lifetime membership for all 25 languages. Yeah. Lifetime. That means you have a lifetime of access to all 25 language courses Rosetta Stone offers for 50% off. Do you understand? That's a steal. Start the new year off with a resolution you can reach. Today, Dark History listeners can take advantage of this Rosetta Stone's lifetime membership for 50% off. Visit rosettastone.com/darkhistory. That's 50% off unlimited access to 25 language courses for the rest of your life. Redeem your 50% off at rosettastone.com/darkhistory.
So Paul was stoked his lab had finally created the pain reliever of his dreams. He knew this drug would be like something special, and he was right because at this point, fentanyl was the most powerful opioid in existence. So it was only a matter of time before Paul's company caught the attention of a company that we've actually discussed on this show before, Johnson & Johnson. Now, you probably recognize Johnson & Johnson from thousands of everyday products. They are everywhere, like baby powder or talcum or baby wash or anything, Band-Aids, they own it all. Well, Johnson & Johnson recognized the potential in fentanyl immediately. So within the year, they acquired Janssen Pharmaceutical, and with it, their star drug, fentanyl. Now, thanks to Johnson & Johnson, fentanyl was now being pushed to a whole new level in the medical world. It was like the new it girl. Hospitals were going through tons of this stuff. It was fast, it was easy, and it was somewhat cheap. Even though it was the drug over in Europe, it doesn't get the FDA approval right away in the United States. That's because there was a certain doctor who was not a fan of this new wonder drug. Now, everyone else, when they saw fentanyl, they saw dollar signs, okay? But this doctor saw red flags all over it and decided he was going to speak up. His name was Dr. Robert Drips. Yeah, last name Drips. That's funny, huh? Dr. Drips. Sounds kind of evil. But he was actually good because he was very much against fentanyl, okay? He didn't like it. At this point, it was like the 60s. Dr. Drips was a professor of anesthesiology, and he strongly believed that fentanyl was it was too strong of a drug, and there was just no use for it. He even went on record warning the FDA that if it was approved, there would be a huge addiction problem with fentanyl. So this is happening, and the creator, Paul Jansen, he hears this, and he's like, guys, don't worry, like, let me talk to Dr. Drips. Now, first, Dr. Drips wants something to do with Paul. But Paul puts together an action plan that would hopefully avoid any addiction problems. The plan basically said that the FDA would only approve fentanyl if it was available in an extremely diluted dose, meaning it was like watered down. You know, it was like a watered down version of the real thing. Now, in exchange, Dr. Drips agreed to stop being so publicly outspoken against the drug if they watered it down. So, Dr. Drips assumed the FDA would be true to their word. So in 1968, fentanyl is approved by the FDA, but only in a very specific 50-to-1 dose, making the high of fentanyl less enjoyable, which in theory would, I guess, make it less addictive. But over the next few years, studies were done, with fentanyl on animals, not people. And these results, again, showed just how effective fentanyl was. Medical professionals thought it was perfect for using in hospital settings, specifically for knocking people out before surgery. Because this was so specific, it never occurred to them that fentanyl could be used or abused outside of a hospital, because it was only for knocking you out before surgery. That was it. No one else could get their hands on it, And just 4 years later, after that promise to Dr. Drips, they, like the FDA and everyone, went around his recommendation, and pure fentanyl became available in the States in a very small amount, but still it was pure. 6 years later, even more restrictions were lifted because they saw more potential in fentanyl. Then, a Belgian anesthesiologist named Jorge de Castro discovered that in higher doses, fentanyl could knock someone out for surgery without affecting that person's circulation. Now, this was good news because other drugs that put you to sleep for surgery sometimes had negative health effects to them, right? Castro reported this to the World Congress of Anesthesia in 1976, and this put fentanyl in the global spotlight. Now, by the early 80s, fentanyl was being widely used in surgical procedures around the world, but then in 1981, fentanyl's patent expired. I don't know. I was like, what does that even mean? I don't even know. Well, a patent is kind of like having exclusive rights or ownership to something. So at this time, only certain companies were allowed to produce and profit off of fentanyl. Well, when that patent ends, that's it. The floodgates just open, and it's for anyone, really. Once a patent expires, all the other pharma companies were allowed to start making it. So a lot of them were desperate to have this incredible drug, so everyone jumped at the opportunity. And of course, lots of money to be made, right? And sales of the drug skyrocketed. Before you know it, fentanyl was coming in a bunch of different forms. By the 80s, they started to develop fentanyl patches. So it's similar to a nicotine patch, but it was fentanyl. Doctors were using these patches on cancer patients who were in major pain. And, it was said to be very helpful to them. But then scientists start to notice a problematic pattern. If the patient had never been on opiates before, that's when things got dangerous. The patch would slow down the user's breathing to the point of almost killing them. But in patients who already had experience with opioids, the fentanyl patch, it worked, and it worked really well. It didn't disturb their breathing. It didn't kill them. It worked. And this is great, but if you don't know which one you are, you don't know what kind of effect you're gonna get. But this was all the FDA needed to hear, really. They wanted good news on the patch, and they got it. So they were approved. Great. Sell it to the masses. By the late 90s, Janssen Pharmaceuticals was a huge moneymaker for Johnson & Johnson. Anything they marketed or sold was bound to take off. It's at this point where creator Paul was looking to expand the market. I mean, adults clearly loving fentanyl. It was working for them, great. But hey, what about the kids? Kids need fentanyl. It's at this point when someone gets the wild idea to invent a kid-friendly version in the form of lollipops. Uh-oh.
It's the start of a new year, which means all the stuff I put off for the last month, I'm now like, oh, darn it. I have to like face all that stuff I put off. Because, holidays. I'm like, well, it's the holidays. I'll do it next year. Anywho, so of course, like, that's everything. Cleaning my closet, getting a haircut, scheduling doctor's appointments. That's the one I put off the longest. I got this like cough and it just wouldn't go away, blah, blah, blah. Anyways, look, period, stop, calm down, because ZocDoc is here for us all. Okay. Look, I love ZocDoc. They make it so easy to find and book a doctor who's right for you and whatever you're looking for. I mean, if you don't know, ZocDoc is a free app and website where you can search and compare high-quality in-network doctors and click to instantly book an appointment. And you don't need to like panic scroll through a confusing website. With ZocDoc, you can filter for doctors who take your insurance, who are located near you, and who are just a good fit for whatever doctor you're looking for. You know what I mean? Also, you can look up verified patient reviews, which I love, because then you can see what's really going up. What are people saying about this doctor, Then, once you find the right doctor, you can see right there on the app their actual appointment openings. You can choose a time slot that works for you, and then you can click and instantly book a visit. You don't even have to talk to anyone. Do you understand? Oh man, it makes it so much easier. Plus, appointments made through ZocDoc also happen fast. I mean, typically within 24 to 72 hours of booking. Plus, you can even score same-day appointments. Yeah, that's the best. So stop putting off those doctor's appointments and go to ZocDoc.com/darkhistory to find and instantly book a top-rated doctor today. That's ZocDoc.com/darkhistory. ZocDoc.com/darkhistory.
Paul Jansen really wanted to tap into a market that wasn't getting fentanyl exposure just yet. I mean, the children, which is why the lollipops came into play. In 1984, a fentanyl lollipop called Oralette was introduced. It was made for kids and adults, again, before surgery. You just suck on it, and I guess it would knock them out in under 15 minutes, which was faster than any drug. Then, in 1998, the FDA approved something called Actic. This was a version of the lollipop that could be used outside of the hospital for cancer patients dealing with chronic pain. Now, this is great. This is fine. That's great, right? You don't want people in chronic pain to be in pain. But this was like the first time you can get a prescription for fentanyl and like take it in the comfort of your own home. Actic was very, very successful. It was manufactured by a company called Teva, but soon other companies started doing the same shit, More and more forms of fentanyl would hit the market. There was like tablets, nasal sprays, film. It was everywhere. I don't know, because I was like, what's fentanyl film? Remember those Listerine strips? They were so cool. If you had a Listerine strip in middle school, it was just like, it was cool. But it was like that. You just put it on your tongue and it disappears. Kind of dangerous, you'd think. Exactly. That's exactly what we're getting at. Great. So meanwhile, Paul Jansen, he sees the success and evolution of his drug, but he's a perfectionist, and I guess it still wasn't good enough for him. After a few years of testing and developing, he and his lab discover an even more concentrated form of fentanyl known as carfentanil. Now, this version wasn't made for hospitals. This new form of fentanyl was approved by the FDA as an animal tranquilizer. Oh, yeah. It was specifically made to take out huge animals like hippos, rhinos, and elephants. So, use your thinking cap. It's got to be a strong drug to take out a freaking elephant, right? Yeah, it took them out. Now, the lethal dose of regular fentanyl is measured in milligrams. Many sources say 2 milligrams are enough to kill an adult man. Now, I know you're out there like, what the hell is a milligram? Well, I'm here to explain it to you, because me too. 2 milligrams, barely covers Abraham Lincoln's chin on a penny. Yeah, so it's tiny. That's 2 milligrams, okay? So, unless you were a first-time user of fentanyl or an accidental user of fentanyl, it's unlikely 2 milligrams could lead to a lethal overdose. But you're playing a very dicey game. And I know you're like, Bailey, how could anyone be like an accidental user of fentanyl? Well, once fentanyl left the hospital and was able to be picked up at the pharmacy and used at home, that's when a black market popped up around the drug. And this is when things start to take a deadly turn. So now it's called illicit fentanyl. In other words, it's illegal fentanyl. Okay? Illicit, illegal. So illicit fentanyl is the name for any fentanyl being used outside of a prescription from your doctor. And in the early 2000s, illicit fentanyl started to become a very big problem, partly because of the potential for addiction that Dr. Drips had warned about. On top of that, this drug was cheap and it gave users a really intense high. Fentanyl is often used as a cheap, quote-unquote, filler drug that gets mixed into pressed pills and powders to make it look like you have more product, but really they fluffed it up with some fentanyl. Does that make sense? These pills and powders then get sold under the name of other, drugs that people are using, like MDMA and cocaine, but you don't know what's mixed in there. It's like a fluffer. The idea is that the user won't know the difference between a fentanyl high and the high of the drug that they think they're buying, unless it's like too late, More and more fatal overdoses start happening. It happened so much that in 2005, the FDA put out a warning against fentanyl, trying to tell people like, hey, this shit is strong. Just want to let you know, okay? But unfortunately, I think when you start to tell people like, this shit is strong, people are like, oh, cool, it's strong, I want to try it, Because that didn't slow anything down. Over the next 2 years, over 1,000 U.S. deaths were caused by illicit fentanyl. So in 2007, there was another public health advisory that was put out about fentanyl again. Hey, you guys, we it's real strong. Just don't do that. Okay. I mean, essentially, it was a nationwide alert saying like, hey, not only are some patients misusing this drug, but a lot of doctors aren't prescribing it correctly. Yeah, so doctors were getting really shady with this because doctors were prescribing Actic, the take-home the take-home version of fentanyl. They were prescribing this all the time. And between 2005 to 2006, more than 80% of patients who got a prescription for it did not have cancer. And that's who it was for. So in other words, they should not have been prescribed it in the first place. So it's like, dude, what are these doctors doing? You're gonna kill people. But it wasn't just doctors overprescribing. This is when drug cartels start to get a little inspired.
So I have this problem. I get emotionally attached to clothes. I mean, for example, every time I want to throw out or donate an old shirt, I can't because I remember all the memories I had with this shirt, and it's hard. And on top of that, I mean, shopping is one of my least favorite things to do. So I just hold on to everything. With that being said, that's why I love using Stitch Fix. Okay? Stitch Fix is an online personal styling service that helps you update your wardrobe without the stress of stores and crowds and, everything. They offer Stitch Fix stylists who can help you pick out items if you need some help, some guidance, but they can also help you put different looks together, which is really nice. So for me, I just gave my stylist my size, my style, my budget, preferences, and then they do the rest. The Stitch Fix stylist will send pieces that they think will look good on me, plus outfit recommendations and styling tips. On top of that, you keep what you love and then you just send back the rest. It's very easy. The best part, you can order a Stitch Fix box whenever you want, and you don't need a subscription. Personal styling for everyone. Get started today at stitchfix.com/darkhistory. That's stitchfix.com/darkhistory.
Now, a lot of the times you hear about fentanyl, is coming in from other countries. So it's is there any truth to this? Who are we mad at? Who are we mad at? Well, starting in 2013, a lot of fentanyl was coming over from Mexico, India, and China. These countries specifically started supplying what was called, quote, precursor chemicals for fentanyl production. Precursor chemicals are essentially like basic ingredients used to make drugs. So think like flour, sugar, baking powder, the basics, right? It's like that. And these basic ingredients can be both legal and illegal. For example, to make meth, a common precursor chemical or basic ingredient is found in Sudafed. So you remember like how they had to like lock up Sudafed because people were like making meth? And I was like, dude, I just want some Sudafed. I'm not making meth. And they're like, we need your ID. And you're like, I just want Sudafed. Anyways, but they had to lock it down, because people figured this out. So illicit fentanyl made from these precursors starts to be mass produced. So drug cartels in Mexico, India, and China are producing it, and they were putting it into other illicit drugs like fake OxyContin. I know, it's so complicated because it's like, why? Why? I don't know. Then like these drugs get smuggled to countries like the United States, and it's even made into pills that resemble other prescription opioids, as well as being put in nasal sprays, eye drops, and even candy. Yeah, I wish I had more information for you there as to like why. I don't know. They just were fucking trying. I don't know, dude. Essentially, when in doubt, do not trust any pill, okay, you find or you get unless you got it at the pharmacy or you got it over the counter. I know, you're just trying to have a good time. I get it. You found a cute pill on the floor. Maybe it could be fun. Suddenly, the DEA, the Drug Enforcement Agency, sees an explosion of people just using fentanyl. At this point, it's still being used in hospitals, right? But it is rapidly moving out of the doctor's office and just into the streets, into everyone's lives. And this is when things really start to snowball. Throughout the 2010s, reports of deadly fentanyl overdoses skyrocket. Starting around 2013, there were countless reports of thousands of young people unintentionally overdosing on fentanyl. Public awareness really ramps up in like 2016, partly because that year, one of the first high-profile overdoses from fentanyl is like all over the news. You know how it goes. They really only start talking about the problem when someone famous or important dies. And that's kind of like what happened here. But sadly, not to like overshadow his death, but like, sadly, Prince, the iconic musician, hopefully thank you, passed away on April 21st, 2016. He was found unresponsive at his Paisley Park estate in Chanhassen, Minnesota. I don't know if I said Chanhassen right. I think it's fine. He was, Anyways, the cause of death was later determined to be an accidental overdose of fentanyl. According to Carver County Attorney Mark Metz, Prince was under the impression that he was taking Vicodin. Metz said, quote, Prince's death is a tragic example that opioid addiction and overdose deaths do not discriminate no matter the demographic, end quote. I mean, fentanyl was affecting people of all genders, races, and social statuses. The following year, a 13-year-old boy in the Jersey Shore area had died from an overdose after taking heroin that had been laced with fentanyl. And then months later, 3 high school students from Washington had died of fentanyl overdoses. One of them was a 17-year-old named Gabriel Lilienthal. And Gabriel thought he was taking oxycodone pills, but the pills were laced with fentanyl. The Seattle Department of Public Health issued a statement warning the public that, quote, teenagers who are not heroin users are overdosing and dying. Do not consume any pill that you do not directly receive from a pharmacy or your prescriber, end quote. I'm going to try and tell people, but kids will be kids and they're going to try and experiment with stuff. And unfortunately, the stuff that they're experimenting with now is so much harsher than years ago, right? That's scary. Fentanyl was constantly being sold as heroin, and unsuspecting victims would, dose it like they normally would. But the fentanyl is way stronger, and boom shakalaka, you are done. Heroin on its own is to blame for many, many drug overdoses. So when you add fentanyl into the mix, the fatalities just quadruple. In 2016, Thomas Frieden, who was the director of the Centers for Disease Control and Protection at the time, said, quote, overdose deaths involving heroin more than quadrupled since 2010. What was a slow stream of illicit fentanyl is now a flood. Mike Senna is the head of the Northern California Regional Intelligence Center. Now, this is an organization that tracks overdose numbers across the United States. He addressed the overdose crisis saying, quote, we had as many people die of overdoses in 1 year as we had die in the entire Vietnam War, end quote. Whoa. So, we have doctors overprescribing it, people abusing it, people getting hooked, pills that are laced, pills coming in from God knows where, people just looking to have a good time, dying. It's cheap, it's deadly, it's a perfect storm, or a flood, as Thomas said. Since 2017, fentanyl trafficking offenses have increased 950%. Okay, I didn't even know the percentage could go that high, okay? Over 3 years, fentanyl deaths increased by almost 550%. I think we can agree that those numbers are insane. It's like, what does that even mean, okay? I don't even know. By this point, things have gotten completely out of control. And that's when we lost another star at a young age.
When it comes to cooking and eating, I've got this problem. Cooking is just not my thing. I try to meal prep, but it takes so much time. Plus, by day 3, I am sick of everything I made. So I usually just cave and then bada bing, bada boom, I order takeout. Hi, thank you. And scene, Anyhow, so it's always a struggle with me. I never know who I'm going to be. So yes, I was struggling over here for a while, but that all changed thanks to Hungry Root. It's the easiest way to eat healthy. Hungry Root is like having a personal nutritionist. They take the stress of meal planning by recommending delicious recipes based on your taste, your nutrition preferences, and health goals. You just go to their website and you tell them about your goals and your preferences. Then they fill your cart with personalized recommendations. They have recipes for every lifestyle. So I'm talking everything from like dairy-free to gluten-free, high protein. Hungry Root's food is high quality and nutritious, and it's made without high fructose corn syrup, artificial sweeteners, or preservatives. They only source top quality meat and seafood free of hormones and antibiotics. And the best part, all of Hungry Root's recipes could be made in just 15 minutes or less. I loved their zesty ground beef quesadilla. It reminds me of like those fast food quesadillas that I would have as a kid, but better because it's healthy. You are going to love Hungry Root as much as I do. Take advantage of this exclusive offer. For a limited time, get 40% off your first box, plus get a free item in every box for life. Go to hungryroot.com/darkhistory and use code darkhistory. That's hungryroot.com/darkhistory. Code darkhistory to get 40% off your first box and a free item of your choice for life. hungryroot.com/darkhistory. Code darkhistory.
If you hadn't heard of fentanyl by 2018, it might have first reached your ears when rapper and producer Malcolm James McCormick, Mac Miller, had died. He was sadly the victim of an accidental fentanyl overdose at 26. Miller was sold counterfeit oxy pills laced with fentanyl. In 2019, the man who sold him the pills and his suppliers were charged with conspiracy and distribution of drugs resulting in death. But what's that gonna do? Arresting them isn't gonna do anything. They're still gonna be selling, okay. The guy who sold him the drugs was ultimately sentenced to 10 years in prison, but putting one drug dealer away obviously doesn't solve anything. But a lot of young people did learn about the dangers of this drug because of his death. Thankfully, since then, there are some things being done to course correct the fentanyl crisis. Kinda. In 2019, China officially started restricting control of internet sites advertising fentanyl, shipping regulations, and even created special teams to investigate leads on fentanyl trafficking. Okay, okay, that sounds good, but what does that even mean? I don't know. But of course, there's fentanyl already in the United States, a lot of it. So in 2021, under President Biden, the United States Department of Health and Human Services rolled out its overdose prevention strategy. They established opioid treatment programs and increased resources for the overdose prevention workforce. And again, it's okay, how about we get the drug off the street? How do we do that, huh? I don't fucking know. No one knows. And look, with all these scary stories, people are still going to take drugs, okay? So this strategy also put funding towards something called fentanyl testing strips. So if something is laced with fentanyl, honestly, you cannot identify it. If it's laced with fentanyl with the naked eye, it's extremely hard to detect. So you can't look at your drugs and be fentanyl. But it also has no taste or scent. So it's kind of like a sticky situation, huh? But with these test kits and strips, you can test any substance to see if it contains fentanyl. It's a nice thought, right? More people can actually test their drugs and hopefully at the very least not die. It's just getting them to actually test the drug before they take the drug. That seems to be the hard part, but it is available. Or maybe you've heard about Narcan. This is a medication that can be injected or come as a nasal spray that will reverse an opioid overdose. Basically, if someone is having an opioid overdose, this Narcan will restore normal breathing. And if you're not sure what kind of drug the person has taken, Narcan won't have any kind of negative effect if it's not an opioid. It's pretty miraculous because someone could be completely unconscious, not breathing, and then if they get Narcan in time, it's they rise from the dead. It's a life-saving drug, and I highly recommend if you work in I have Narcan in my house. I don't do drugs or anything, but I'm not judging. And if someone comes over and I just want to have it just in case. I don't know. I just have it. Just have it, okay? In most states, Narcan is available at pharmacies with no prescription. You can just walk right in there. You can ask for it. Sometimes your insurance might cover it. Certain places have community programs, local public health groups, or local health departments that will hand out Narcan for free. Over at endoverdose.net, I'll link it below. You can even order Narcan or buy test strips. I'm not saying you should be doing drugs or anything, but I'm coming from a place of no judgment. And I think it's nice to have these just in case, because you never know what you're going to get out there. Okay? And you can save someone's life if they need it, Now, to this day, obviously, fentanyl is still used in hospitals and still manufactured legally. So if you get a fentanyl drip after surgery, for example, like I did when I got my nose fixed, it wasn't a drip, was it? It doesn't matter. I got fentanyl. There's no need to freak out. For the most part, you should be fine. Most of us don't realize that fentanyl started off in a medical setting, and no one except Dr. Drips could have predicted that things would go this far south. I mean, especially not with a drug that was so promising. I mean, Paul Jansen created a monster, a Frankenstein. No, that was Dr. Frankenstein. Whatever. But he started out wanting to just relieve people's pain, not cause more of it. Allegedly. Well, I don't know. In total, nearly 645,000 people have died from overdoses, including any opioid, prescription, and illicit fentanyl from 1999 to 2021. That's a lot of people. Yeah. And as of 2021, the rate of death from fentanyl alone was 21.8 per 100,000 people. Yeah, that's a lot, huh? It might not sound like a lot, but it's more than double the rate of deaths from meth, quadruple the rate of deaths from heroin, and more than 7 times the rate of death from prescription opioids. It's deadly, is what I'm getting at. In 2023, the DEA seized nearly 80 million fentanyl pills, which is beep, bop, boop, boop, beep, boop, 386 million deadly doses. Ooh, that's enough to kill like every single American. Oh my God, is that how we're gonna go out? Is that how the world ends?
I have been having the hardest time finding a good bra. It's challenging. If you have boobs, it's never ending, huh? My drawer is like filled to the brim with bras. It's before I leave the door, I usually just grab a random sports bra and then hope for the best. I mean, you see me sometimes, like, I just kind of go braless some days. I just give up. I mean, between like underwire and like the weird straps, I feel like every bra I try on just makes me feel like it's not right. It's not right, But thankfully, this changed when I found Skims bras. Now, Skims bras, oh man, they have become my everyday bra because, well, there's so many to choose from, but they're lightweight and also able to still hold up the boobage and give real support. They come in all these gorgeous neutral colors, so you don't have to worry about like the bras matching your outfit, just match like your skin tone. But I still always get black. I don't know what my deal is. I love like a black bra. Do you remember the movie 10 Things I Hate About You? And it was like, oh, she has black underwear. That's what I think of. My go-to is usually the Fits Everybody Scoop bralette. Oh yeah, I have it in 4 colors. I don't know what happened. Listen, but the fabric is buttery soft and it has a really nice stretch to it. With other bralettes, I feel like, if you make one wrong move, a boob's gonna pop out. Come on, it is. A boobie is definitely flipping out. With the Fits Everybody Scoop bralette, I get the best of both worlds. The support of a sports bra and the comfort of a bralette. Plus, it's so much cuter. Shop Skims Best Intimates, including the Fits Everybody collection and more at skims.com and Skims stores. After you place your order, be sure to let them know we sent you. Select podcast in the survey area, and then you can select our show Dark History in the drop-down menu if you wanted to. That would be cool. If not, that's okay too. Okay, now let's get back to the story.
So it's like, who's to blame here? I'll wait for an answer, thank you. I mean, I think it's Big Pharma for pushing it out and making it available to everyone. Once it left the hospital setting and became something that you could take home, I don't fucking know. That's the part, I still don't get because there's still so much mystery around it. Of course, unless I do some undercover investigating and try to go to where these fentanyl labs are at. Could you imagine if I turned Dark History into investigative journalism? I'm gonna go find where they're making this fentanyl and be like, what the fuck are you guys doing? You're killing everyone. But the weird problem, I thought it was odd. Fentanyl, this whole fentanyl problem seems to be a unique problem to the United States. Other countries don't have this problem as big as us. So what is it? Big Pharma? Johnson & Johnson? Is it our state of mind? I feel like during quarantine, I noticed that's when a lot of people I knew started dabbling with drugs because they were alone and not well, and they started messing around, and then they got drugs and then they died. I feel like it's a combination of a lot of things. It's just unfortunate. A lot of people are quick to point the finger at, the people using the drugs. Specifically the addicts. Whenever you bring up the heroin was laced with fentanyl, people are like, well, they shouldn't have been doing heroin in the first place. And it's just addiction is a mental illness, okay? Why is that so hard to see? And why is it so hard to care? Why is it so hard to care? What we used to call drug addiction is now recognized as substance use disorder, or SUD. And it's defined as a treatable mental disorder. And part of this is genetic. As our expert said, quote, genetics loads the gun, but something else pulls the trigger, usually society and culture, end quote. Addiction, whether it's alcohol, drugs, gambling, sex, eating your husband's ashes, it's not a moral failing. It doesn't make you a bad person. You just need proper help and support around you. And for some, that can be the hard part. It's hard. Addiction is hard. If you're familiar with anyone who's struggling with addiction, it's not easy, right? It completely ruins lives and families. It's ugly. sucks you in, nothing else matters except getting your fix or just having fun like one time. But listen, things don't have to be this way. Things can get better. I know a lot of people say it, like, you're not alone. There are people who care. But like, really, you're not alone. Sorry, you're not alone though. There are people who care. I care about you. I don't want to go to any more funerals because someone died of fentanyl overdose. I'm sick of it. So can you please stop? Okay, thank you. If you or someone you know is struggling with addiction, the SAMHSA helpline provides free confidential help 24/7. You can call them up, you can get treatment referral and information about mental health and drug or alcohol use disorders. You can talk prevention and recovery in English and Spanish by calling 1-800-662-4357 or text your zip code to 435748. I know sometimes like calling these numbers or texting is kind of weird. It's like, I don't have a problem. I didn't talk to anyone. But sometimes just talking to someone, like talking things out, can help tremendously. It really can. American Addiction Centers offers a free substance abuse self-assessment, as well as tools to determine what treatment options are appropriate and available in your area. The National Suicide Prevention Hotline is available 24/7 by dialing 988. Well, this has been a ride. I read your comments, I heard your pleas, and guess what? We're going to be covering one of the most infamous events in history. This person went missing at the peak of their career, and they were a trailblazer because guess what? It was a woman, and they're at the center of some very controversial conspiracy theories. Next time, we are talking about the strange and unsolved disappearance of America's sweetheart, Amelia Earhart. Well, friends, thank you for hanging out with me today. I hope you learned something new. I'm not sure what you learned. Let me know down below in the comment section. Did you know you can join me over on my YouTube where you can actually watch these episodes on Thursday after the podcast airs? And while you're there, you can also catch my murder, mystery, and makeup. Now, I'd love to hear your guys' reactions to today's story, so make sure to leave a comment down below so I can see what you're saying, and I might read your comment in the future. So now, let's read a couple of comments you guys have left me. Brown Sugar 342 left us a comment saying, "Hey boo, Tiffany here. Love both your channels so much. Tell Paul and Joan I said what's poppin'." Did you hear that, you guys? Tiffany said, "What's poppin'?" What's poppin'? She wants to know. Tiffany wants to know. Don't be rude. Well, thank you so much, Tiffany, for watching. I appreciate you so much, and I'm glad that you like both shows. And what's poppin'? Just Paul's hip. Pops out of place a lot. I don't know. What is poppin', you guys? What are we doing today? We're just hanging out today. Thanks, Tiffany. Love ya. Serafina24 left us with this interesting thought. Does anyone else wonder if random things have a dark history, like air conditioning or hand sanitizer? Or is that just me? Serafina, listen, that's exactly how dark history started. I sat around and I looked around and I said, where did that thing come from and why do we have it? And then I started Googling, and then you go down a rabbit hole and you learn like, oh wow, I swear, look at anything in your house, a vase, and then be like, history or dark history of the vase. And it'll take you on a journey. Because everything comes from something a little kooky and weird, okay? We are weird people. And I love it because I'm curious, and I can tell you're curious too. So stay curious and learn. Be a sponge. Absorb it all. Okay? Learn. Yeah, I'm just like you. Don't worry. 1998 Dancer Girl. Okay, Dancer Girl. I'd love to see you do an episode on the Rock Springs Massacre. You are doing such important work bringing these stories to light. I seriously love this series, MMM and you. Oh, thanks, Dancer Girl. Great username. 1998. Love that. Good year, huh? Britney Spears released Baby One More Time in 1998, so I think that was a pretty good. Is that why you're Dancer Girl? Because you were dancing along with Britney? Honestly, Dancer Girl 1998. I haven't heard of this massacre, Rock Springs Massacre, so I will get to Googling and I will report back. I haven't heard of it, so thank you for the love, and I'm always open to suggestions. So if you guys have any, make sure to leave them down below. Always on the lookout to learn something new. I appreciate you guys for watching and hanging out with me. Please be safe out there. Take care of yourselves. Try not to do drugs. I know, I love you, okay? And I want you to be around. Yes, I do. And hey, if you don't know, Dark History is an Audio Boom original. I want to give a big special thank you to our expert, Dr. Patrick Lockwood. And I'm your host, Bailey Sarian. I hope you have a good day, you make good choices, you be safe, and you take care of yourself, and all of that, okay? All right, I'll be talking to you guys really soon. Goodbye.